With this, we move on to the second scientific session of second half, that is role of key nutrients in nutrition management of diabetes. And to speak on this particular topic, I would like to invite Dr. Mridul Bera sir, who is the founder member of Howrah Diabetes Study Society as well as being the treasurer to the organization. He is a very well-known consultant physician and diabetologist practicing in Howrah. I welcome you, sir, on stage. To chair this particular session, I would like to invite Dr. Deepak Kapoor, who is an experienced senior general physician, and along with him, Dr. Kaushik Pahari, sir, who is a physician and cardiologist, and also the executive committee member of Howrah Diabetes Study Society. With this, I invite both the chairpersons and speaker for the next session.
Hello.
Okay. Sorry for the technical glitch.
I think Mridul doesn't require any introduction, but the topic is very interesting because majority of us actually neglect the nutrition portion of the diabetes management, because nutrition has got a major role to control diabetes. So this is very much important topic, and I think Mridul will light on these topics very nicely. So hand over to Mridul.
Thank you, Kaushik, for your kind introduction and for about the role of nutrition and diabetes. And before I'm going to the main topics, I'm a little bit undercooked because of the busy schedule I have got. So may I need any help? His dietitian is also there and chairperson is also there. So I'll be talking of the role of key nutrients in the management of diabetes. Now if you see the topic, the key nutrients, I'll be talking on the nutrition and I'll be talking on the key nutrition in managing the diabetes. So this is my CV, I'll not go through it. So what is the healthy diet? This is in nutshell, this is a healthy diet. You have to avoid the junk food, you have to reduce your sweet intakes, if you have to plan your meals, eat more fruits and vegetables in every day. And you have to cut down on alcohol, and definitely you have to aim for try to reduce your weight. Now, what is the goals of nutrition therapy? Very, very important. So you will give the patient the nutritional therapy. What is your goal? What do you want to achieve? Definitely to promote and support the healthful eating patterns. Very, very important. Emphasizing a variety of nutrient-dense food in appropriate portion sizes. Then you have an aim to reach a goal, maybe your weight goals, maybe you have to attain the glycemic goals, the blood pressure goal, lipid goals, all has been important. And to delay the complication of diabetes, may it be microvascular and the macrovascular, you have to address the individual nutrition based on personal and cultural preference. And because we are living in a country where the different cultural peoples are living in the different parts of our country, you have to give the patient the pleasure of eating. If you give the patient the diet, the patient will not enjoy. Probably you will not take the diet. You will, after a few days, you will quit. And also to provide an individual with the diabetes the practical tools for the developing the healthy eating. And you have to give the patient the different literature. You have to give the patient the videos, and you have to give the diet charts according to your choices or according to the dietitian choices. Now, before I'm going to give the patient the dietary advices, you have to definitely consider certain factors, particularly when dealing with the diabetes. Whether the patient is a type 1 diabetes or type 2 diabetes, you know the type 1 diabetes is a lean thin one. So you have to improve the calories. And a type 2 diabetes, because of the insulin resistant patient used to be in an obese side, so you have to reduce the calories. Presence of comorbid condition, very, very important. If the patient is cardiovascular disease, already suffering from cardiovascular disease, renal disease, you have to give the certain advices according to the disease the patient has along with the diabetes. Current drug regimen is also been important, because if you are going to give the patient in a lean thin individual, where I have to give the patient the SGLT2 inhibitors, always the SGLT2 inhibitor reduce some weight, so I have to improve the calories also. Treatment goals is important before going on to give the patient the diet. Weight loss, the target blood glucose level is important. And the most important thing that you have to realize what is the education the patient has. What is the patient's psychological background? If you give the patient the diet that is very difficult to understand for the patient, probably the patient will not take it. So it is important to make people with diabetes understand what is the need of the diabetes advice or the dietary advice, and you have to make changes in the dietary plans. So there is the medical nutrition therapy that is very commonly we often prescribe to the diabetic population. What does it mean by the medical nutrition therapy? So medical nutrition therapy is a therapeutic approach to treat a medical condition and their associated symptoms, not only in diabetic, but it can be given to any patients who have been suffering from any other chronic conditions. Especially is it tailor-made and definitely is monitored by medical doctors or a registered dietitian like the Sumunti has. The diet is based upon the patient's medical record. I have already told about it, the physical examination, functional examination and dietary habits. And in medical nutrition therapy, a dietitian or the doctors will decide and monitor what to eat, how much to eat and when to eat. So what is the guidelines on the medical nutrition therapy in diabetes management? So these are the guidelines. You don't have to remember all this, but just take a look. Nutritional assessment, I have already told about it. Then setting the goals. What is the goals? The practical, achievable and acceptable goals. If you say the patient, we have to target reduce the weight of 15 kg and is in a 75 kilogram individuals in a 6 months, this is not practical. Individualize the nutritional intervention, including the nutrition education. Very, very important. Patients have to know what to eat and how to eat. You have to individualize the meal plans. And most important things, and time and again you have to evaluate the patients, whether the patient is going to the target or not. So maybe your patient is like this and your doctor is like this. Your diet is so bad that your arteries are all blocked, but the angioplasty should open things up and get the maple syrup flowing again, maybe. So what is the guidelines for the major components of the diet? I'll talk on this issue because my talk is about the main, that is the component of the diet. So first I will start with the carbohydrate. You know this, just a quick recapitulation. 55 to 60% of energy should come from the carbohydrates. And that carbohydrate should be complex in nature, not in a simple carbohydrate, because if you take a lot of simple carbohydrate, it can raise your blood sugar and definitely it can cause the complication in the futures. Monitoring carbohydrate, whether by carbohydrate counting, not very essential, but you have to remember that. Carbohydrates from the foods high in fiber, that is preferable. And fruits with the low glycemic index and glycemic load should be consumed, because our previous speaker, Dr. Arjun, with that already told about it, what is about the low glycemic index food and the low glycemic load food. Substitute the low glycemic load foods for the higher glycemic load foods may improve the glycemic control. And definitely the non-nutritive sweetener like the sucralose or you can say the saccharin definitely elicit a sweet sensation without increasing the blood glucose. That is also be preferable. Polyol carbohydrates like the sorbitol, the mannitol, erythritol, xylitol, disaccharide, isomaltose, maltitol, lactitol, these are the non-calorigenic. These are the low glycemic. These has got the low energy and low insulinic and low digestible and osmotic carbohydrate. That type of carbohydrate should be preferred in a diabetic patient. What about fiber? Very, very important. So you have to give the patient the carbohydrate with fiber. Carbohydrate with no fiber, it should be discouraged. People with diabetes should consume at least the amount of fiber and whole grains that is recommended for the diabetic, for the non-diabetic people, so general people. So how much is required? At least you can say the 40 gram per day, particularly in a 2000 kilocalorie diet. This is the fiber recommendations. High fiber containing carbohydrate sources like the legumes, the whole grains, the bread, cereals, fruits and vegetables, that is the carbohydrate with fiber, that should be preferred. And they should be included as part of the dietary carbohydrate intake. What about the resistant starches and fructose? These should be preferred because resistant starches at the starch enclosed within the intact cells. And these resistant starches are completely fermented in the colon, and resistant starches reduce the risk of hypoglycemia and hyperglycemia because these type of carbohydrate not digested or not absorbed as glucose, but they are very rich in proteins and other minerals. What is the example of the resistant starches? Like the raw potatoes, cooked and then cool potatoes, green bananas, legumes, cashews and raw eggs. These are type of resistant starches we should prefer to give to the patient of diabetic. What about the proteins? Definitely is an important component of any dietary advice. The protein should provide at least 12 to 15% of the total energy intake of people with diabetes, next to carbohydrates. And proteins from the vegetable sources like the pulses, the soy grams, peas, low-fat milk, low-fat carbs, fish and lean meats are definitely recommended. And supplementation of these proteins within carbohydrate, like you can always the patient like the type of khichdi or you can say the dalia, definitely can improve the protein quality and also the give satiety to the patients. What about the fat? The fat should provide 20 to 30% of the total energy intake for people with diabetes. It is not that you should take low, that is the nil fat. That is not recommended. Ideal amount of total fat definitely with the diabetes is not established, but the quality of fat is important as well as the quantity. Individuals with the diabetes and dyslipidemia may be able to modestly reduce the cholesterol by consuming the plant sterol or plant sterols. Plant stanol or plant sterol. This is the type of diet which is rich in cholesterol but devoid of any cholesterol containing food like the other fatty foods. These are the legumes, these are the vegetables, oil, nuts, cereals and seeds. They are plant sterol or plant sterol that will not increase the cholesterol, but it is very useful for the patients. Now what is the types of fat and the contribution of the fat in our diet? The first thing you have to remember, you have to reduce your fat in the terms of saturated fat and trans fat. You have to reduce. How much? Saturated fat should provide less than 10%, and if a patient is a very dyslipidemic patient, you have to reduce it by less than 7%. All animal fats such as those in meat, poultry and the dairy products are saturated fat. So you should discourage the patient to take. Processed food, fast food, these also contain high amounts of saturated fat. What about trans fat? Trans fat should provide less than 1% of energy and preferably totally avoided. What is the types of trans fat? Usually present in the ready-made food, the processed food. These are very rich in trans fat. You have to reduce the trans fat and the saturated part. But you have to take the PUFA and MUFA. So PUFA at least should provide 10% of the energy among the 20 to 30% of energy of total fat. And this is a combination of fat, whether omega-6 and omega-3, and the omega-6 by omega-3 ratio should be around 5 to 10. And this type of fat is very, very essential for anti-inflammations and the normal brain function and the growth. And this is available in the vegetable oils, the corn oil, safflower oil and the soybean oils. What about the monounsaturated fatty acids? MUFA should provide 10 to 15% of energy plus the any calories left from the carbohydrate pattern. This is also important. And this is probably found in the vegetable oils such as olive, peanut, canola oils and the remain, and this type of fat remain liquid at the low temperature. So the polyunsaturated fatty acid and monounsaturated fatty acid we should give the patient to take, and you should avoid the saturated fat and the trans fats. So let's see what is the recommendation we have got from our RSSDI guidelines. First of all, you should take about the carbohydrate. 45 to 65%. On an average, you can calculate is around 50 to 60% of total calorie should provide from the carbohydrate. And predominantly low glycemic index foods is preferable. And this type of low glycemic food should be abundant in the soluble and insoluble fibers. So you can say the substitute the polished white rice with a brown rice. So that is more preferable. What about the protein? At least 15% of the total calories should provide, we should get from the proteins. And addition of, you can say the insulinic cereal pulse mixture is recommended because it is very rich in high fiber with a high protein diet. Fat intake, I have already said about it, less than 10% of the saturated fat so you should take, minimal trans fat intake, and dietary cholesterol is less than 300 milligram per day. What is the other recommendation? You have to reduce the intake of refined sugar, moderate intake of this is artificial sweeteners like aspartame, the sucralose, saccharin, the neotame, and this type of artificial sweeteners you should take in a moderate amount. Dietary salt intake, it should be less than 5 grams, and you should avoid the alcohol consumption and the tobacco consumption. Now talking about the glycemic index, because I have repeatedly talked about the low glycemic index food. What is the glycemic index? Glycemic index is a scale that ranks carbohydrate rich foods by how much they raise the blood glucose level. And high fiber, low glycemic foods can delay the absorption of glucose in the bloodstream, so that should be preferable. And if you can see what is the glycemic index, high glycemic index food, this is the grain products and the potatoes have high glycemic index, followed by the moderate glycemic index like the legumes and the whole grains, and followed by the non-starchy fruits and the vegetables, they have the low glycemic index food. So the basic technique for using the low glycemic guidelines is you have to for that approach. You have to replace the high glycemic index food with the low glycemic foods. Now this is the glycemic the index and a scale that ranks the carbohydrate by how much there is the blood sugar level compared to the reference weight. Now this is the ranking, the low glycemic index food like 0 to 55, moderate 56 to 69, and high is 70 or more. So we should take low glycemic index food compared to the high glycemic index food. I have already told about this. Now I will go to the macronutrients part. Apart from the carbohydrate, fat and proteins, biotin, you know that. The biotin works in the synergy with insulin, particularly in a diabetic patient it is important. Biotin works in the synergy with insulin in the body and independently increases the activity of the enzyme glucokinase. So the glucokinase is responsible for the fast rate of glucose utilization. So if you supply the biotin in the form of diet, it can definitely increase the activity of insulin and it will increase the glucose uptake in the cell. What is the example of this biotin? Legumes, egg yolk, and organ mats, nuts, seeds, mushroom, avocado. These are the type of biotin that is available in the food. What is about the vitamin D? Vitamin D has a number of benefits, but I think it is an overhyped, produced by the body in response to the sun exposure. This is commonly produced in the body. And also there are some food that is very rich in the vitamin D. You all know that. The milk and milk product, the dairy product, the mushroom, salmon, zograt, and this type of food has got enough amount of vitamin D. Another thing is the zinc. The presence of a zinc deficiency in the body has also been suggested to contribute to the development of diabetes. So zinc deficiency can cause the diabetes. This is theoretical, but again it is yet to be proved. The zinc itself may be a crucial element of insulin metabolism. So theoretically, if you provide the zinc in your diet, probably it can help reduce the amount of the hyperglycemia, or I say to prevent the diabetes. The zinc is well known as a powerful antioxidant as well. What is the example of the zinc in the food? Pumpkin seed, legumes, egg, cashew meat, spinach, almond, and garlic fish. These are very rich in zinc. What is the chromium picolinate? You all know that, you already heard about it, that it can help in the diabetic patients. So this is how it helps. Chromium enhances the biological action of insulin, the hormone that is critical for the normal regulation of carbohydrate, lipid and the protein metabolism. And chromium helps insulin work more efficiently to allow blood sugar to move to the cells. So chromium helps the insulin bind to the insulin receptors that line the cell membrane. These bonds stimulate the glucose transporter, which move to the surface of the cells and allow glucose to enter the cells, so the glucose can be betterly utilized. So these are the example of these chromium picolinate. Broccoli, green beans, whole grains, eggs, vegetables, they are very rich in chromium picolinate. Now I will end up my talk with this cartoon. Maybe you can ask your patient, why don't you lose weight with the diet I have advised? Probably maybe your patient can answer, because I am not a loser. Thank you.
Thank you, Mridul, for this nice deliberation. The detailed deliberation was there. I think you told all the aspects of the nutrition rather. But one aspect you told just, this is white rice. I think white rice is not good rather.
Why?
Brown rice, I think.
Brown rice, I guess.
But I think this is not so tasty and it's costly also.
Yes.
So
but
they
it is very rich
would
in
not
fiber
able to.
because it has not been polished. If you just want to polish the rice,
Yes.
Maybe sometimes they said সবাই slim কে পছন্দ করে slim ছেলে পছন্দ করছে slim মেয়ে পছন্দ করবে মেয়ে পছন্দ করছে slim ছেলে পছন্দ করবে this is not in the case of rice.
Yes.
If you go for the slimmer rice, that will not provide anything.
Yes,
that will cause the high glycemic index will be there.
And the other thing you have told already is nice. They should also maintain this for the diabetic patient. But I think 90% of the patients does not follow this.
Yes.
They will the last picture was very nice. So if any questions from the audience.
I have a comment
Dr.
to make
Somani.
regarding you have so well described our diet and all. Fasting should also be included as a part of dietary advice.
Yes.
Intermittent fasting or reducing the number of feeds to say from 4 to 3 to 2, even 1 is also recommended.
Yes,
the
yes.
idea being to keep the beta cells function as much preserved as, because
Yes.
we can't reverse it. Cure is not possible.
Cure is not possible.
Yes, so we should give rest to beta cells, and this is intermittent fasting of longer duration, gradual, reducing the number of dives to 3 to even 1. Animals usually take 1 or 2 feeds a day, and the incidence of diabetes among animals in the whole animal kingdom is far, far less than
Yes.
human.
But the studies
But Dr.
have said
Somani,
that
we are the bad animals. We are
We are bad animals.
yes,
We are right.
absolutely we are bad animals because we are.
And of course, the Israel issue has also proved
There is
it
the
that we are
control.
much-
The food is there in front of you. Rather, they are just able to control that.
And
that-
in them,
this is
if
very
we-
much-
You have mentioned many patients we cannot convince them about this. So if we can
Actually,
convince them,
one patient has came to my clinic, and when I told him you have to stop smoking, so then before I say to stop smoking, he told me, डॉक्टर साहब जो मैंने पीता हूँ ना उसको छोड़ के और कुछ आप बोलिए, मैंने स्मोकिंग छोड़ना नहीं है, ठीक है, तो और कुछ जो है उसको जो प्रिवेंशन है.
you can ask them to begin smoking as say after 10, 11, as many hours if you can keep away from smoking. That is only we can do.
Because they knows.
They-
After knowing all these things, they will continue that.
we call prudent blockheads or Sayana Pagals.
Yes.
Thank you.
Any question? If any not there, then I should conclude this session. Okay, thank you, Mridul, thank you.
Thank you, Dr. Bera, for this wonderful session. And I would like to request Dr. M.L. Bansali, sir, to kindly felicitate our
এই
chairperson.
আমাকে ফেলিসিট করুন আমাকে
Yes, sir. Thank you, sir.
আরে ডক্টর আজারি থেকে আমি জাস্ট দিয়ে নিয়ে তোমাকে দিয়ে দিচ্ছি